Closing my curtain. Gonna provide patient privacy. Gonna use hand hygiene. Hello, my name is Shalonda. I'm gonna be your student nurse today. And I'm a Chamberlain student, BSN student, Urban Campus. And can I get your first and last name, sir? Okay, Mike Evans. Okay, Mr. Evans. Can I get your date of birth? August the 20th, 1982. Okay, Mr. Evans. I am here today because I do have an order to go ahead and place a nasogastric tube in you today. It's just to relieve some bladder distension and to ease the pain on your stomach and just to take some of the puffiness down so we can take some of those contents out of your stomach. Okay, now Mr. Evans, I have also obtained consent to go ahead and do this procedure. And going forward, do you have any questions or anything for me? Okay, no? So, are you, can you tell me what day it is and time? Okay, today is the 11th at 10:22. Okay, and it is in the morning, correct? And do you have any allergies to shellfish, iodine, latex nuts, or anything I failed to mention? Okay, and on a scale of 1 to 10, 10 being no pain, 10 being the worst pain, 0 being no pain, can you tell me your pain level? Okay, no pain. And what about a history, or do you feel like you're in any pain or nausea or vomit or anything like that? Okay, Mr. Evans. And also, do you have a history of aspiration, anticoagulation, using anticoagulation therapy, facial surgeries or facial construction, nosebleeds, or nasal polyps? Okay, so let's go ahead and get started. Can I go ahead and check your gag reflex real quick? Okay, you have good gag reflex. And also, let me check the patency of your nares. Okay, and again, no history of a deviated septum, nasal irritation, or turbinate irritation, or anything like that. Those weights. Okay. So getting started, I do have all of my materials, my 3 pieces of tape, and my area has been wiped down. And I'm going to go ahead and place my gloves on. I have elevated my bed to hip length. I'm going to elevate the head of the bed, high filers, and everything that's locked and secured. My bed is locked and secured. I'm going to go ahead and get started. Listening to my patient's lung sounds, and heart sounds, and bowel sounds. And again, I am going to let you know that this is a very uncomfortable procedure. So if at any time you feel discomfort, you just throw your hands up and I'll know that's my signal for us to kind of stop and take a break. I'm not trying to torture you. Okay, I'm going to go ahead and cover you up. I have my syringe here. And I have my Emerson basin. Emerson's basin. So I'm going to open my supplies. Just gonna coil my tube. Coil my tube. And I am going to measure my patients on the most patent nostril side. I'm going to measure from his nose to his ear and from his ear to his xiphoid process. So let's go ahead and do that now. Nose to ear, and from the ear to the nose, and then to the xiphoid process with about 6 inches left. Okay, I'm going to mark that off with tape. My stopping point is. Okay, now again, I'm going to go ahead and get started, and you let me know if you feel any discomfort. Okay, getting started, I'm going to go ahead and dip my tip 4 to 6 inches in lube. I'm going to go ahead and start to go up my patient's nostrils. And once I feel his nasopharynx, first of all, I'm gonna get my pen light to make sure it's in the back of the throat. Okay, keep going. Okay, once I feel the nasopharynx, I'm gonna turn 180. Okay, and my client is starting to gag just a tad, so I'm going to pull back, and I'm going to let him do the chin to chest method, and swallow, and swallow, and swallow, and swallow. Okay, swallow, swallow. Almost down. Swallow, swallow, swallow. Okay. Almost got it. Okay. I'm going to check again to make sure. Okay. My tube is in the back of the throat. I'm going to take my tape, that piece of tape, and hold it in place. Or my split piece of tape to hold it in place. Would help if my gloves were the correct size. I have gloves that are too big, so. Okay. So. All right. So the next thing that I'm going to do is I'm going to listen to my clients. So now I'm going to listen to my clients' lung sounds again. Lung sounds. Okay, so just to make sure my tube is not in the lungs. Okay. Now I'm going to just listen for a swoosh. Okay. Swoosh can be heard. Now I'm going to take the same needle and I'm going to aspirate, the same syringe. I'm going to aspirate and check on my pH. Okay? Gastric content is 4. So that's good. We're in the correct place. I'm going to leave it placed. Now I'm going to take my tape, my last piece of tape, and place it on my client's gown with a little slack. Alrighty. So my client does have his just tube placed. I'll go ahead and take the syringe out. Now the next thing that I'm going to do is assess for any, just to see how he tolerated the tube. I'm going to check for any redness, any bleeding, any pain. Did you tolerate that okay? Okay, your nostrils. No irritation? Okay. So now I'm going to take off my gloves, perform the proper hand hygiene, lower the bed, make sure his collar is in reach, and we're good to go. Okay, now I'm coming back in my room. I'm gonna put my gloves, or do hand hygiene again, put the gloves back on, and I'm going to remove my patient's NG tube. Just want to assess my client for any discomfort. Are you in any pain or anything? You do have orders. It's time for me to go ahead and take your tube out. So first thing that I'm going to do is go ahead and start taking the tape off of everything. Okay, and I'm going to have to let you know that this is going to be slightly discomforting. Okay, take a deep breath. 1, 2, 3. 1, 2, 3. There you go. There you go. Taking everything off, placing it in my trash receptacle. I'm going to look at my patient's nares again. See if we have any drainage or fluid or anything from his nose. Trying to see if he needed any tissues, so I can help you. Give you a tissue. Is there anything else I can get for you? Are you in pain? On a scale from 0 to 10, 0 being no pain, 10 being the worst. Okay. Taking off my gloves. Provide the proper hand hygiene again. Gonna lower the side of my patient's bed. Let the side rails up. Lock the bed and put his collar in reach. And you let me know if you have any other problems or if you have any issues. And thank you. Have a good day. Bye-bye.